The scream echoes through the stone chamber. A man lies strapped to a wooden table, his leg shattered beyond repair. The surgeon raises his saw. There's no time for hesitation, no time for doubt. In less than 2 minutes, this will either be over, or the man on the table will be dead. The year is 3047, and this is just another Tuesday. You wake up with a toothache. It's throbbing, pulsing. The kind of pain that makes you want to crawl out of your own skin. But there's no dentist to call. No pharmacy down the street. No little white pills to make it stop. There isn't even a medicine cabinet in your house. So you do what everyone does. You go see the barber. And yes, you read that right. The same person who trims your hair is about to pull your tooth. Somehow, against every odds stacked against you, you might actually walk out alive. This is the world of medieval surgery. A world where the tools are crude, the knowledge incomplete, and death lurks in every shadow. And yet, lives were saved. Miracles happened. People survived things that should have killed them 10 times over. By the time we're done here, you'll never look at a barber pole the same way again. Let me paint you a picture. Medieval Europe had 2 types of healers. The physicians were the elite, the educated, the ones who studied dusty books in universities and quoted ancient texts like scripture. They wore fine robes and prescribed treatments from a distance. But here's the thing that might shock you. They almost never touched their patients. Getting your hands dirty with actual human bodies, that was beneath them. That was manual labor. That was for someone else. Enter the barber-surgeons. These weren't scholars. They didn't go to university. They learned their trade the hard way, watching and doing, apprenticing under someone who'd seen more blood than most soldiers. They already had sharp blades for shaving, so the leap to cutting flesh wasn't that far. Need a tooth pulled? The barber, broken bone. The barber, bleeding out from a wound. The barber, major surgery that could easily kill you. You guessed it, barber. Imagine walking into your local hair salon today and seeing a sign that says, haircuts, shaves, and emergency amputations. It sounds insane. But back then, it was just how things worked. These barber surgeons weren't bumbling amateurs, though. They couldn't afford to be. When you're working without modern tools, without safety nets, without backup plans, you either figure it out or people die, and people were dying anyway. So they had to get creative. They had to innovate. They developed techniques that were, frankly, incredible, given what they had to work with. You know that red and white pole that spins outside old-fashioned barbershops? Most people think it's just decoration. It's not. That pole tells a story written in blood. The red represents blood. The white represents the bandages. And the pole itself, that's the wooden stick patients would grip during bloodletting, squeezing it tight to make their veins bulge and easier to access. Every time you walk past one of those poles, you're walking past a memorial to an era when your hairstylist might also be the person who saves your life. But let's talk about what really happened in those rooms. Let's talk about pain. Picture this, you're that man on the table. Your leg is ruined. Infection is setting in. You can feel the heat radiating from the wound. See the angry red lines crawling up your thigh. The surgeon explains what needs to happen. The leg has to come off. There's no other option. You nod, because what else can you do? They strap you down with leather bindings. Your hands grip that wooden pole so tight your knuckles turn white. And then it begins. There's no anesthesia. Not like we know it anyway. Medieval surgeons had something they called soporific sponges. Cloths soaked in opium, mandrake, hemlock, other herbs whose names have been lost to time. You'd inhale the fumes or suck on the sponge, and maybe, just maybe, the edges of the pain would blur a little. Think of it like comparing a bicycle helmet to a modern car airbag. Sure, it's better than nothing, but you're still going to feel every second of what's about to happen. The real secret to medieval surgery wasn't the drugs. It was speed. The best surgeons could take off a limb in under 2 minutes. That's not an exaggeration. They kept records. They competed, because every second you spent in agony was another second closer to shock. and shock killed faster than blood loss ever could. There was a surgeon named Ambroise Pare, one of the most famous of his time. He wrote about what it was like, the screaming, the way patients thrashed against their restraints, the sounds that haunted him at night. He wrote that those screams drove him to find better methods, gentler techniques, anything to reduce the suffering. But even he couldn't escape the fundamental truth. Surgery meant pain. Surgery meant trauma. And surgery, more often than not, meant death was waiting just around the corner. Here's something that puts it all in perspective. 400 years after the medieval period, during the American Civil War, surgeons were still operating without reliable anesthesia. One doctor documented performing 300 amputations in 48 hours during a single battle. 300 men screaming, 300 lives hanging by a thread. The medieval surgeons weren't that different. They just had fewer wars and more time to practice their craft between emergencies. But there was another enemy in those medieval operating rooms. One they couldn't see. One they didn't even know existed: germs. Medieval surgeons had absolutely no idea that microscopic organisms caused infection. The microscope wouldn't be invented until the late 1500s, and even then, it would take centuries before anyone connected those tiny creatures to disease. Germ theory didn't become widely accepted until the 1800s, so for medieval surgeons, infection was just this mysterious force that sometimes happened and sometimes didn't. They had a term for the pus that oozed from surgical wounds. They called it laudable pus. Laudable, as in praiseworthy. As in good. They genuinely believed that pus meant the body was healing properly, that it was a natural and necessary part of recovery. Spoiler alert, it absolutely was not. Post-surgical infection was so common that it was just considered part of the deal. You had surgery, you got infected, and then you either fought it off or you didn't. Those were the odds. But here's where the story takes a strange turn. Some of the things medieval surgeons did, purely by accident, actually worked. They cleaned wounds with wine and vinegar. They had no idea why. But we know now. Both are mildly antiseptic. They dressed injuries with honey. Honey has natural antibacterial properties. They sometimes applied bread mold to infections, and certain bread molds contain compounds that work similarly to penicillin. They were doing the right things for completely wrong reasons. Trial and error over centuries had led them to treatments that genuinely helped, even though they didn't understand the science behind any of it. It's like how ancient people discovered that chewing willow bark helped with headaches. They didn't know about salicylic acid or how it works. They just knew it helped, and eventually, that knowledge led to aspirin. Sometimes you can stumble into the truth, even when you're walking in the dark. Now let's talk about what these surgeons actually did, because this is where things get both terrifying and impressive. They performed trepanation, that's drilling holes directly into someone's skull. They did this for head injuries, for migraines, for pressure on the brain. Archaeologists have found medieval skulls with perfectly circular bore holes that show clear signs of healing around the edges. That means the patients survived. These surgeons were performing brain surgery with hand-operated drills, and people were walking away from it. They did cataract surgery. They'd take a needle and push the clouded lens down to the bottom of the eyeball, a technique called couching. It didn't give perfect vision, but it was better than blindness. Imagine trusting someone to stick a needle in your eye while you're fully conscious. Arrow removal was its own specialized skill. You can't just yank an arrow out because of the barbs. Pull wrong and you'll shred everything inside. Medieval surgeons developed special tools. Some would carefully widen the entry wound and extract the arrow the way it came in. Others would push the arrow completely through the body and pull it out the other side. Both methods sound horrific. Both saved lives. And then there were cesarean sections. Incredibly rare. Almost always fatal for the mother. But there are documented cases of successful C-sections performed in medieval times, often by desperate husbands trying to save their babies when their wives were already dying. Can you imagine that moment? The fear, the grief, the slim hope that at least one life might be saved. The tools these surgeons used came from everywhere. Blacksmith tools became bone saws. Fishing hooks were repurposed as surgical retractors. When you don't have a medical supply company, you improvise. You make do. You turn whatever's at hand into an instrument of healing. So what does all this mean for us? Sitting here centuries later with our hospitals and our antibiotics and our anesthesia. It means human beings are tougher than we think. Those medieval patients endured procedures that would send modern people into shock just from hearing about them. And they survived. Not all of them, not even most of them, but enough to matter. Enough to prove that the human body can withstand incredible trauma when it has to. It means progress happens slowly, one small victory at a time. Every technique these surgeons developed, every patient who beat the odds, added to a growing body of knowledge that eventually became modern medicine. We were standing on foundations built by people who worked by candlelight with blood on their hands and prayer in their hearts. And it means we should be careful about judging the past. It's easy to look back and think, how barbaric, how primitive. How could they? But these surgeons were working with everything they had. They weren't savages. They were problem solvers. They were innovators. They were people trying desperately to help other people with whatever tools their era provided. Think about this. 500 years from now, people might look at our medicine with the same horror. They used to cut people open with knives. They poisoned cancer patients with toxic chemicals and hoped the cancer died before the patient did. How barbaric. How primitive. Progress never stops. What seems miraculous today will seem outdated tomorrow. The cycle continues. The next time you see a barber pole spinning in the wind, stop for a moment. Really look at it. Those red and white stripes represent centuries of humans trying to heal each other despite impossible odds. Medieval surgeons performed what we'd call miracles without anesthesia, without antibiotics, without even knowing what caused infection. They worked in literal and figurative darkness, and they still saved lives. If that doesn't make you believe in human determination, I don't know what will. But here's the question we haven't asked yet, the question that changes everything. If they could do all that without modern technology, what were they getting wrong? What killed the patients who didn't make it? And more importantly, what finally changed? The answers might surprise you.